Venezuelan state security agents captured 2 more mercenaries in the state of Aragua this Tuesday who were involved in the failed May 3rd incursion. Doctors in Peru have demanded that the government of President Martin Vizcarra declare a state of catastrophe and request international medical aid to confront the COVID-19 pandemic. The Africa Centers for Disease Control and Prevention reported today that the continent has recorded over 23,000 COVID-19 recoveries. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. Venezuelan state security agents captured 2 more mercenaries in the state of Aragua this Tuesday who were involved in the failed May 3rd incursion into the country. The capture of both subjects was carried out in the town of Colonia Tovar as part of mop-up actions following the frustrated incursion in the framework of the Bolivarian Shield Tiburon 2020 civilian military operation. Venezuelan government authorities have reiterated that they will maintain patrols and tracking operations throughout the country in the face of threats from mercenary groups. Venezuelan Vice President for Communications Jorge Rodriguez this Tuesday presented new evidence and testimonials about the failed armed incursion of May 3rd supported by the governments of the United States and Colombia.
Juan Guaidó has signed a contract with the U.S. company that provides security services which maintain close ties with the administration of Donald Trump and with Vice President Mike Pence, which also substitutes through the signing of this contract all the legal and constitutional elements of rights and duties that are contained in the Magna Carta of the Bolivarian Constitution of the Republic of Venezuela. The book of all of us, to which we are all bound, is hereby repealed by the signing of this contract.
Cuban Minister of Foreign Affairs Bruno Rodriguez offered a press conference this Tuesday on the terrorist attack that took place at the Cuban embassy in Washington, D.C. on April 30th.
This is a terrorist action committed against our diplomatic mission in Washington that cannot be seen as a separate issue, but as a result of the aggressive policy and discourse of the government of the United States against Cuba, the hatred speech and the permanent instigation to violence by U.S. politicians and extremist groups, anti-Cuban extremist groups who have turned these sort of attacks into a way of life.
And Cuban President Miguel Díaz-Canel stressed on Twitter this Monday that his government is awaiting answers from Washington regarding the machine gun attack on the Cuban embassy in the US capital in the early hours of April 30th. He stressed that Cuba does not forget the long history of terrorism against its diplomats. The president noted that Cuba saves lives and rejects violence and death. Venezuelan President Nicolas Maduro offered a televised address this Tuesday to warn that it was not time to relax the measures implemented to prevent the spread of the novel coronavirus.
And this is a reflection I want to make because on Sunday night I realized from watching TV broadcasts, the news, that there was a regression on the part of the political leaders of the country, leaders of the revolution, doing events with people, relaxing the strict safety measures which have led us to control the coronavirus. If you relax, I say to Venezuela, if you relax, compatriot, if you let people in your family relax, we could have a resurgence of the virus as is happening in Japan.
A fifth flight carrying more than 46 tons of medical supplies from China arrived in Venezuela this Tuesday. The shipment arrived through the permanent air bridge established between both nations since the outbreak of the epidemic. The shipment contains about 80,000 PCR tests for the detection of the novel coronavirus, as well as about 4 million masks and gloves. The authorities announced that the medical supplies will be distributed across all the health centres of the country immediately to reinforce the fight against the COVID-19 pandemic.
A month ago, President Xi Jinping and President Nicolas Maduro held a fruitful telephone conversation in which they reached consensus on cooperation and, above all, on cooperation in this battle against COVID-19. I would say that this precisely is because of the efforts by both parties to implement the agreements of both presidents, that the fifth shipment of medical materials and supplies necessary for this battle in Venezuela against COVID-19 has arrived.
Doctors in Peru have demanded that the government of President Martin Vizcarra declare a state of catastrophe and request international medical aid to confront the COVID-19 pandemic. Doctors attending the local population in Iquitos, Loreto and other areas of the Peruvian Amazon have been infected with the coronavirus, reducing the number of health personnel able to continue providing care in the midst of the spread of the virus. The Peruvian health sector has issued an urgent call on the government to mobilize the necessary resources to address the health crisis in the rural areas of the country.
More than 50 hospitalized doctors in a serious condition who are in ICUs, those who have died, those who are in Lima. The hospital has no more than 13 to 15 doctors for the entire hospital. I think this situation has already overwhelmed all our human capacity. That's why today we demand the government declare the state of catastrophe and disaster in Loreto. President Vizcarra, please listen to the voice of the people of Loreto. Listen to the voice of the doctors. Declare Loreto in a state of disaster and catastrophe. At the time, we demand that our governor, Ivan Ochoa, please at least do something good, that he requests international aid, that doctors come from other sister Latin American nations and worldwide to provide solidarity to Loreto. Today, the first to be hit in this firing line against COVID-19 have been the doctors.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. Dr. Anthony Fauci, a key member of the White House Coronavirus Task Force, and other public health experts, including the director of the Centers for Disease Control and Prevention, testified at a Senate hearing on the COVID-19 pandemic this Tuesday. Our correspondent in Washington, Jorge Gestoso, has the details.
Dr. Anthony Fauci, which is a top expert within the White House regarding the coronavirus pandemic, was testifying in front of the Senate. He was doing it from home. But the two most important messages that he conveyed was that an early opening of the economy is causing suffering and death, and also that the pandemic could come back by fall if not all the measures are going to be taken. Most definitely, it has been a lot of reaction among the senators. For example, Senator Murphy, he was in a way criticizing Dr. Fauci because of being, and he was politically correct, he mentioned in his speech, and he said that that could have criminal consequences. On the other hand, the President Trump was yesterday afternoon doing a press conference. He absolutely contradicts everything that Dr. Fauci is preaching and saying, and he says that that the cases are going down, which is absolutely not true, that he was saying that is enough testing, that is absolutely untrue. And in the case, for example, of the cases going down, the new data shows that now is catching in rural America. For example, in terms of the increase, in Central City, Kentucky, 650% increase. Charlotte, North Carolina, 200% increase. Kansas City, Missouri, 200% increase. Nashville, Tennessee, Des Moines, Iowa, and Amarillo, Texas, more than 72% of increase. So therefore, we are far, far from having this pandemic under control, as President Trump is trying to say, and most definitely what President Trump is trying to do, it has, according to all the analysts, and political agenda, which is his re-election. We get back to you now.
Russia confirmed nearly 10,900 new COVID-19 cases in the last 24 hours, bringing the total to more than 232,000, the third highest number worldwide. Russia now has the world's second fastest rate of new infections, according to the official data, behind the United States. Despite reporting more than 10,000 new cases a day for over a week, the government announced on Monday that a non-working period in place for 6 weeks will be lifted from Tuesday. A lockdown in Moscow, the epicenter of the outbreak in Russia, remains in place until the end of May. However, some restrictions are being lifted. Some 500,000 employees of industry and construction companies are now allowed to return to work. Meanwhile, authorities have made it mandatory to wear masks and gloves in shops and on public transport. In the United Kingdom, the opposition Labour Party has questioned the government as to whether workers who feel unsafe can refuse to return to work. Chief Medical Officer Chris Whitty stressed in a press conference on Monday that the reopening of workplaces was dependent on whether they can be made safe for work. Following pressure by trade unions this Tuesday, the Chancellor announced that the furlough scheme would be extended until autumn and the government would continue to fund 80% of furloughed employees' salaries until the end of July. However, from then on, employers will be asked to pay some of the 80% salary, sparking fears that many will be forced to go back to work. The UK COVID-19 death toll has surpassed 32,000, according to official figures, with over 226,000 cases nationwide. The Italian government will relax some coronavirus restrictions across the country from May 18th. The central government has decided to give power to regional authorities to lift restrictions on businesses which had originally been due to reopen from June 1st. The move, announced late on Monday, came after pressure from regional leaders to be allowed to establish their own reopening plan. However, safety measures will need to be implemented before the establishments can open. Italy, one of the world's worst hit countries by the pandemic, has reported over 221,000 cases, while the COVID-19 death toll has reached almost 31,000, the third highest in the world. The Spanish Health Ministry reported on Tuesday that the number of newly diagnosed coronavirus cases fell to its lowest number in more than 2 months. Health authorities identified 594 new cases on Tuesday, bringing a total to over 228,000. Meanwhile, over 170 new COVID-19 fatalities were reported, taking the death toll to almost 27,000. The Spanish government has ordered a 2-week quarantine for all overseas travellers arriving in the country from May 11th in a bid to curb the further spread of the virus. The state of emergency is due to end on May 24th, but Spain has so far extended its restrictions 4 times since mid-March.
The greatest risk, in addition to local infections, will be imported cases. We will then return to a situation similar to the one we were in at the end of February. So we must do prevention, at least for a sufficient period of time, to ensure that we are not at risk until the other countries reach the level of control that we have achieved.
A 113-year-old Spanish woman is believed to have become the oldest person in the world to recover from the novel coronavirus. Maria Brañas, the oldest person in Spain, confirmed she had tested positive for COVID-19 last month, despite showing no symptoms. An update on her Twitter account, run by her daughter on Friday, announced that she had overcome the disease. Ms. Brañas, who was born on March 4th, 1907, thanked people for their good wishes in a further tweet posted on Tuesday. The Chinese city of Wuhan, where the novel coronavirus was first identified, plans to test all its 11 million residents for the virus. The plan issued by the local government is in its early stages, with all districts in Wuhan told to submit details as to how testing could be conducted within 10 days. The decision came after the city recorded 6 new positive COVID-19 cases over the weekend. Prior to this, it had seen no new cases since April 3rd. Wuhan, which was under a strict lockdown for 11 weeks, began reopening businesses, schools and resuming public transport on April 8th and is gradually returning to normal. And we're taking one last short break now, but stay with us for more. Welcome back to From the South. The Africa Centres for Disease Control and Prevention reported today that the continent has recorded over 23,000 COVID-19 recoveries. The member states of the African Union also reported that a total of over 66,000 coronavirus cases have been reported in the continent and more than 2,000 deaths. South Africa remains the worst hit country with over 11,000 cases, but a relatively low number of fatalities at just over 200. Lesotho continues to be the only African nation not to have reported a single case of the coronavirus after 48 suspected COVID-19 patients tested negative. The number of coronavirus cases in South Africa surpassed 10,000 on Monday as the government expressed concern that the city of Cape Town could become an epidemic hotspot. Health Minister Sireleni Mkhize noted that concern that the Western Cape and Eastern Cape provinces combined make up 84% of the total number of new cases, which is going to require even stricter restrictions. Despite increasing numbers of daily infections, the minister said they were encouraged by the number of recoveries, which stands at more than 4,300. South Africa has the continent's highest number of confirmed cases, but a relatively low number of COVID-19 fatalities, which is thought to be due to widespread testing. Since May 1st, the government has been gradually easing the lockdown measures.
Which stood at 4,000. Since May 1, the government...
Mauritius has declared itself coronavirus-free, having not reported any new cases for 15 days, and with all those confirmed having recovered. According to the Ministry of Health and Wellness, the Indian Ocean island has registered 332 COVID-19 cases, the same number of recoveries, and 10 fatalities. The report also added that more than 73,000 COVID-19 tests have been carried out in the country, which has a well-developed healthcare system. Approximately 73% of health services are provided by the public sector. With a population of 1.2 million people, Mauritius ranks as one of Africa's highest GDP per capita economies with a high Human Development Index. Lesotho's Prime Minister has announced he intends to hand in his resignation on Wednesday, a move that could help resolve a long-running political crisis in the tiny kingdom. Prime Minister Thomas Tabane, aged 80, faces possible prosecution over the killing of his ex-wife. Tabane, whose 5-year term was due to run until 2022, said he felt ready to retire and was tying up loose ends to ensure the process was as smooth as possible. His coalition government was dissolved this week, with Parliament due to meet on May 22nd to form a new government and name a new Prime Minister. Tabane's party, the All Basotho Convention, has nominated Finance Minister Mereketsi Majoro as his successor. According to Tunisian health authorities, this Monday the country reported no new COVID-19 cases for the first time since early March. The Tunisian government also announced that it would further relax restrictions on movement and businesses. The North African country, which confirmed its first case on March 2nd, has reported more than 1,000 cases in total and 45 deaths. Tunisia started relaxing a nationwide lockdown last week, reopening parts of the food, construction and transport sectors and allowing half of government employees to return to work. The government stressed, however, that it expects the economy to shrink by up to 4.3%, the steepest drop since gaining independence in 1956. At least 15 people were killed and 56 others injured after a suicide blast hit a funeral in Afghanistan's Nagaur province on Tuesday. Meanwhile, another attack caused the death of 2 babies and 11 mothers in a maternity hospital in Kabul, while dozens more were injured. The number of casualties from both attacks could rise, and it is not clear who carried them out. The attackers, who gained access to the maternity hospital as they were dressed as police officers, were all killed by security personnel after a battle lasting hours. The Taliban, which signed an agreement with the United States aimed at ending the war more than 2 months ago, has denied any involvement. A second batch of medical supplies donated by China arrived in Indonesia on Tuesday to assist local COVID-19 containment. The donated supplies included medical and surgical masks, medical goggles, protective screens and suits, isolation gowns, medical shoe covers, medical gloves, infusion pumps, portable knapsack sprayers, infrared thermometers and thermal imaging cameras. Chinese Ambassador Xiao Qian and Indonesian Defence Minister Prabowo Subianto were present at the official handover ceremony. Indonesia has reported over 14,700 COVID-19 cases and 1,007 fatalities.
This ceremony symbolizes the close friendship between the People's Republic of China and the Republic of Indonesia. The People's Republic of China, in its own campaign against COVID-19, to send assistance to its friend here in this region, is truly a mark of your friendship and your solidarity with us.
Many artists across the world have come up with initiatives to raise awareness in the midst of the coronavirus pandemic. And we finished this news brief with one such example by Ugandan pop stars Bobby Wine and Nubian Lee, who produced the song Coronavirus Alert with lyrics on how to avoid the risk of spreading the virus. I hope you enjoy the music. For Telesur English, I'm Katrina Goss, and thank you for watching.
The bad news is that everyone is a potential victim. But the good news is that everyone is a potential solution. Sensitize the masses to sanitize, keep a social distance and quarantine. Stop!
The coronavirus is sweeping over mankind.
Everybody must be alert. It's a global pandemic we can never take for granted. Kila mtu must be alert. It's a matter of life we can never take for granted. Discipline and personal hygiene, and make sure you regularly wash your hands. Keep a distance from everyone. Report anything like a symptom. Serious fever is a symptom. Dry cough is a symptom. Walkway tamula is a symptom. Itchy eyes and flu is a symptom.
Butabusiga, batannalwala.